Seniors often trust the pills they've been prescribed or buy over the counter, hoping to reduce pain, ease anxiety, or improve sleep. Yet a wave of studies reveals that certain well-known medications, commonly used by older adults, may dramatically heighten the risk of dementia. In some cases, changes in thinking can appear in just a few months, long before anyone suspects the real cause. Today, let's look at 7 categories of medications that have been tied to cognitive decline, memory issues, or early signs of dementia. Knowing these risks may help you have an informed conversation with your doctor about safer strategies. Medication number 1 is opioids. Many seniors initially receive them after surgery or for chronic pain. One individual in her 70s had a knee replacement and was prescribed an opioid for post-operative pain. She kept renewing the prescription and took it long beyond the typical recovery period. At first, her family noticed only small lapses. She'd walk into a room and forget why she was there, or she'd misplace her glasses multiple times a day. Gradually, though, she asked off-the-wall questions about why her bed seemed to hover above the floor, and once insisted she lived in a different part of town. 3 years after staying on this medication, she was diagnosed with early-stage dementia. Studies suggest that opioids can dull pain, but also suppress vital brain circuits responsible for reward and memory. Over time, it's as if parts of the brain go into hibernation. That persistent slowdown can have lasting consequences, especially for seniors who are already vulnerable to memory loss. If someone you know has been on opioids for an extended period, it might be worth discussing with their healthcare provider whether continued use is truly necessary and whether alternatives might be safer. Medication number 2 is benzodiazepines. These drugs are typically prescribed for anxiety or insomnia. A man in his late 60s, grieving the loss of his spouse, found it impossible to sleep and was given a small dose of a benzodiazepine to help him cope. Within months, his family noticed confusion. He began forgetting whether he'd eaten breakfast. He once placed multiple empty cartons in the freezer, believing they were full of food he planned to eat later. A few years later, he showed symptoms consistent with moderate dementia. Research shows that the longer seniors remain on benzodiazepines, the steeper their risk of memory problems and disorientation. These medications work by slowing brain activity, which can bring relief for anxiety or restlessness, but that same effect can chip away at the ability to form new memories and stay focused. Low doses might be helpful for short-term stress, yet seniors can easily slip into routine long-term use without understanding the potential harm. Anyone who's been on benzodiazepines for months or years might want to bring this up with a doctor and explore safer approaches to anxiety or sleep difficulties. Medication number 3 is muscle relaxants. Some older adults receive them for persistent muscle spasms, back pain, or neck stiffness. One woman in her early 70s was given a muscle relaxant after complaining of chronic tension in her shoulders and upper back. She stuck with it for relief, but her family noticed changes that went beyond simple forgetfulness. She poured milk into her shoes one day and mixed up her kitchen pantry for the bathroom at night. At first, these incidents seemed like innocent, absent-minded mistakes, but they escalated to the point where she often didn't recognize her own living room. Eventually, she was diagnosed with early-stage dementia. Studies link muscle relaxants to higher rates of confusion and impaired cognition in seniors, partly because these drugs lessen the brain's overall alertness. This sedation might feel mild at first, but over time, it can undermine the neural pathways involved in memory and awareness. While muscle relaxants can offer short-term relief, there's a real need to weigh whether the benefits outweigh the risks for older adults, especially if the prescription stretches beyond a brief window. Medication number 4 is first-generation antihistamines. These older allergy medications are often sold over the counter, and many seniors reach for them to address seasonal allergies or to help with sleep. One older man who had long-standing issues with congestion decided to take an over-the-counter antihistamine nightly. In just over a year, he began repeating the same questions minutes apart, and on one occasion he lost his wallet in the freezer, insisting someone else had hidden it there. Soon he grew disoriented driving to places he'd visited for decades. Over time, he was found to have early signs of Alzheimer's. Researchers have discovered that first-generation antihistamines block a vital brain chemical known as acetylcholine, which helps neurons communicate effectively. In older adults, levels of this chemical may already be low, so blocking it further can hasten cognitive decline. Unfortunately, these medications are still marketed as safe sleep aids. So many people remain unaware of the potential dangers. If a senior is relying on these antihistamines frequently, especially before bed, it might be masking a deeper issue with sleep or allergies that should be addressed in a different way. Medication number 5 is sleep medications. Many of them are prescribed specifically to fight insomnia. A woman in her late 60s struggled with persistent insomnia and was given a popular sleep aid. Soon, she was waking in the middle of the night feeling confused, and her family saw her pacing the house, talking to herself. She also began mixing up names of longtime friends, calling them by completely different names in casual conversation. By the time she turned 71, she had mild cognitive impairment that seemed to progress quickly. Research shows that while prescription sleep medications might knock people out, they can disrupt the deeper stages of sleep that the brain needs to repair and consolidate memories. Missing out on that crucial slow-wave sleep can accelerate mental decline and make existing memory problems worse. Older adults sometimes assume that if a pill helps them rest, it must be beneficial, not realizing that true restorative sleep goes beyond sedation. Alternatives like adjusting bedtime habits, exploring certain supplements, or addressing underlying conditions might be safer in the long run. Medication number 6 is statins. These drugs are commonly used to lower cholesterol. One man in his early 70s received a high-dose statin after a routine check showed elevated cholesterol. In a relatively short period, his wife noticed he was making statements that didn't line up with reality. He attempted to water his houseplants with pancake syrup, confused about what he was doing. He also mixed up his spouse's name with that of a childhood neighbor. Eventually, he was diagnosed with early dementia. Some studies suggest that in older adults, especially those on higher doses, statins might be linked with forgetfulness or memory difficulties. Researchers propose several mechanisms, such as lower levels of coenzyme Q10, which is crucial for neuron energy, or cholesterol levels dropping too far, affecting how brain cells maintain their connections. Statins can save lives in individuals with serious heart risk. Yet for some seniors, the specific dose or type might need reevaluation, particularly if confusion arises. It's worth asking a healthcare professional about the balance between cardiovascular benefits and any possible cognitive impacts. Medication number 7 is proton pump inhibitors, often used to control acid reflux. A woman in her mid-70s had relied on them for years, thinking it was the only way to soothe her chronic heartburn. Eventually, she complained that everything tasted like metal, even plain bread or water. She got suspicious about her husband's cooking, insisted it tasted burnt even though it was untouched, and then started forgetting the purpose of simple items around the house. Her confusion spiraled until tests revealed early dementia. Studies suggest that long-term use of proton pump inhibitors may increase the risk of cognitive decline. These medications can reduce the absorption of crucial nutrients like vitamin B12, and some research indicates they affect gut bacteria in ways that might influence inflammation or brain health. Because they're effective at controlling acid, many people take them for years without a second thought. But those who notice unexpected changes in memory or taste might benefit from discussing alternatives or a plan to taper use. It's never easy to suspect that a medication, perhaps taken faithfully for months or years, could be linked to memory loss. For seniors, every prescription should be weighed carefully, especially when there are signs of mild confusion or when the prescription extends longer than initially intended. If you or a loved one is on any of these medications, it might be worthwhile to check with a healthcare provider about safer options or dose adjustments. Sometimes, stopping or reducing these medications early might allow the brain a chance to recover. In other instances, damage may be more difficult to reverse, but being proactive can still slow further decline. The goal isn't to create fear, but to encourage older adults and their families to stay alert and ask questions. You deserve to know whether the pills in your cabinet are affecting more than just pain or insomnia. Thank you for watching, and remember that staying informed is a powerful way to protect your well-being. If you found this discussion helpful, there's more to explore in upcoming videos. So take a moment to learn all you can and keep prioritizing your health.